Core Measure 2, Drug Interaction Checking. The objective of this measure is to ensure that providers have implemented the functionality within their EHR system to validate medications against other medications and or against medication allergies that the patient may have. There really is no measurement required here other than having the functionality turned on. Therefore, as a client of Prognosis, when you request to have meaningful use enabled in your practice, this functionality is automatically turned on, and therefore you are automatically compliant. Now, when it comes to attesting, that is really the only requirement, is to attest to the affirmative that the functionality is in fact been turned on in your practice and that you have access to that feature during your reporting period. There is no set numerator, a specific percentage of patients that you must have alerts on. It is simply a system-enabled feature. As such, there are no exclusions built in. In order to be compliant, you simply have to have the feature turned on. And just as a final note, the prescriptions alert may never occur, and yet you will still be deemed compliant. So to see what this means, actually, I'm going to toggle into Prognosis, and we're going to do this on the prescription screen. You can also do this from your current medications on the face sheet, depending on how you have your properties defined. Now, for my prescription screen, I've already entered one drug, but I want to enter a second drug now to see if the alert is going to pop up. So I'm going to go ahead and enter this second drug to my patient and update it to my prescription. And notice when I save my prescription to the patient, now that I have a combination of drugs, it would also be looking at my medication allergies if I had any. This prescription alert has now popped up. This is a demonstration of Core Measure 2. The prescription alert functionality has been turned on, and therefore, if you are prescribing a combination of drugs that have conflicts with one another, the alert is going to warn you to that. Now, obviously, if you are prescribing drugs that have no conflicts, you will never see this pop up. So that is why there is no requirement for a number, a minimum requirement, for instance. It is simply the feature exists. If you see it, you have a choice whether you want to ignore it, go ahead and update the prescription anyway, regardless of the conflicts. If you want to overwrite it, which is when the system is alerting you that conflicts exist, but you've decided that the benefits outweigh the consequences, and so you want to go ahead and ignore that indication, and it will therefore specify and ask you to specify a reason, or you can choose to fix it. Now, the control of these radio buttons and even the presence of them as to whether they display or not is really property driven, and that is based upon your choice. So I'm going to go ahead and go under Settings Configuration. Now, you'll notice that I am logged in here as Dr. Cooper. So this is a property that Dr. Cooper has access to. If you are trying to reach this property to define the severity level and you find that you are restricted, then you would have to go through technical support or your project manager at Prognosis. Typically, though, the physician will have access to this. I have gone under Admin Properties, and I am simply searching for the property called Prescription Parameters. And within this Prescription Parameter table, I'm going to scroll down almost to the bottom, and there are two properties here in the middle called Severity Level. One of them is for drug disease, where it's going to look at the allergies, and then the other one is drug-drug, where it's going to look at drugs in comparison to one another. And you see in the help that you can list these properties as either a 1, 2, or 3, and that is controlling the level of severity. In the least severe cases, that means give me the pop-up even if it simply causes a minor redness or a skin irritation. Whereas moderately severe may cause a rash or hives or the need for antibiotics, and most severe could, of course, cause anaphylactic shock, coma, or death. So that's going from one end of the spectrum to the other, but since the functionality is yes or no, and to be compliant, you must have it turned on, this gives you a little bit of flexibility with regards to the severity so that you're not seeing the pop-up 100 times a day, but you are seeing it when it's actually critical. So with regards to just a checklist to wrap up your summary here of drug interaction checking, first of all, the feature will be automatically enabled by Bismatic staff when you turn on meaningful use. You will then enter any combination of drugs or drugs and drug allergies on the chart. And if there are conflicts, that is when this pop-up alert will occur. You can define the severity level under the properties in order to control the frequency of the alerts. But generally speaking, this measure overall is actually a freebie because you are simply going to attest to yes, the feature exists within your practice.